Thinking about building a family and welcoming children into your life is a beautiful journey for many. It is a natural part of planning for the future, full of hopes and dreams. For men living with cystic fibrosis, it is important to know that while your fertility journey might look a little different, the good news is that fatherhood is often still very much a possibility. The core fact is that the vast majority of men with cystic fibrosis experience infertility, a condition often referred to as congenital bilateral absence of the vas deferens, or CBAVD. Now let us dive into why this happens. The cystic fibrosis transmembrane conductance regulator, or CFTR, gene mutations primarily affect mucus production throughout the body, and this includes the reproductive system. In males with cystic fibrosis, the CFTR protein, which is normally responsible for regulating the flow of salt and water in cells, does not work correctly. This disruption leads to the development, or rather the lack of development, of the vas deferens, which are the small tubes that transport sperm from the testicles. Most commonly, these tubes are either completely absent or become blocked with thick mucus during development, preventing sperm from traveling into semen. So, what does this mean for you, and what steps can you take? The path to fatherhood for men with CF typically involves specialized medical assistance. The first crucial step is to consult with a urologist who specializes in male infertility. They can perform an assessment to confirm the diagnosis and discuss the available options. One of the most common and successful approaches is sperm retrieval, where sperm can be extracted directly from the testicles through a minor surgical procedure. This retrieved sperm can then be used in conjunction with assisted reproductive technologies, such as in vitro fertilization or IVF, to achieve pregnancy. It is also a really valuable idea to consider genetic counseling as part of your family planning. This will help you and your partner understand the genetic implications for any potential children. Specifically, a genetic counselor can explain how CF is inherited and assess the likelihood of your children being carriers of the CF gene or developing cystic fibrosis themselves, especially if your partner also carries a CF gene mutation. This insight empowers you to make informed decisions for your future family. Ultimately, understanding CF-related male infertility is about gaining knowledge and embracing the many advanced medical options available today. While the journey may require a bit more planning and medical support, remember that becoming a father is a very real and achievable goal for many men with cystic fibrosis. By working closely with your healthcare team and exploring reproductive technologies, you can confidently pursue your dreams of starting a family.